Danny, you've got an interest in pediatric osteopathy. I wonder if you can describe your work with young babies and their mothers.
Okay, so pediatrics is, I think, a difficult field to work in because you're dealing with many dynamics, specifically around newborn babies and the feelings of anxiety surrounding that. So often it's first-time parents who are bringing their children for treatment, and a lot of the time it can be due to over-anxiety about the health of the child, which puts the osteopath in a difficult position, I believe, because often what I would consider are normative conditions are often conditions that are worrisome to the parents, such as, for example, reflux, clicking joints, torticollis, certain types of torticollis. And the osteopath is expected to put these things right, when often, like I say, they are normal and are a matter of time until they get better by themselves. And so a lot of the time it's juggling the anxiety of the parent with the osteopathic work.
Right. Okay, so tell me about the difficulties that come from the fact that your patient can't speak to you and tell you where the pain is, that you're having to rely on now a third party, you might say, to get a better sense of the clinical picture.
Well, the way I sometimes look at it is that the feelings that are being brought up in me as a practitioner in the osteopathic setting are there to analyze and to get information about how the baby might be feeling. In other words, if the parents are making me feel anxious, then it's possible that there's a degree of anxiety around the birth of the baby. Either the parents are anxious, making the child anxious, which can obviously affect matters such as feeding and sleep. And so that is the kind of material that I use to help me move forward in the treatment of the baby.
Okay.
And helping the parents to possibly understand that.
Right. So yes, you want to help the parents understand the nature of anxiety, their anxiety, which may be projected into the baby. But would that stop you from actually doing a physical application hands-on to the baby?
It would not. First of all, there are often physiological issues still to be treated, which might be the result of anxiety, or it might be the result of a traumatic birth. So that an anxious child or anxious parents may well be anxious because there is a physical condition. So yeah, I would continue to treat the baby in the normal way. I would add to that sometimes the autonomic nervous system, or the baby as a whole, can reflect its inner world or its feelings through its body, through a tight belly, through short breaths, through a tight neck, all those kind of things. So I would say that treatment can continue along with knowledge of the emotional.
Right. So what's it been like for you to conduct your practice over a long time, I presume, that integrates the physiology and the psychology of the patient?
Well, I would say not always smooth, but sometimes very rewarding. It's a very difficult juggling act to try and be able to be a physical practitioner treating the physical in babies in this case, and at the same time be an understanding, empathetic point of view which is different to that of the parents, and helping the parents overcome cases where it might be purely anxiety that is spurring on the need for treatment. So it's a very difficult sort of juggling act.